Welcome to the Jock podcast featuring Dr. London Smith. He's a real doctor with an even realer podcast. Now introducing your host, Dr. London Smith.
Hello, and welcome to the Jock podcast, where we discuss fitness and health and how to incorporate our modern understanding of science and medicine into our daily lives, but without it being so boring. I'm your host, Dr. LondonSmith.com. I would like to begin by apologizing to our listeners. We have received some feedback complaining about the amount of technical terms we've been using, such as body and nail bed. So we will try to simplify terminology in the future. Here to assist with that, actually not here today, he's actually calling in because he said he had a previous engagement, is our producer Cameron. Cameron is like a weather vane. He's always looking to where the winds of trends and popularity are blowing. Are you with us, Cameron?
Dr. London?
Yes, that's me.
Can you hear me, Dr. London?
Yes. Yeah, you're a little choppy, but we hear you.
I'm here. I'm alive.
Okay,
Barely,
good.
but I'm alive.
I'm sorry, barely?
Yeah.
Okay, because you said you had an appointment. You didn't say...
Yeah, an appointment with fate.
Okay.
An appointment with finally finding things out.
Well, okay.
An appointment with, taking down the government.
Okay, because I thought it was a dentist thing or something. So are you in D.C.?
There is a guy here looking at my teeth, but I don't think he's a dentist.
Okay. Do you know why he's looking at your teeth? Where are you? What are you seeing?
There's a tree. There's grass. There's green grass, but some of it's brown.
Okay. So I guess it's warm maybe wherever you are?
I'm trying to keep this a little secret, but...
Okay, but you're trying to take on the government wherever this is. Is that right? Are you not responding, or are you just breaking up? Okay. We'll go ahead and move on from there. Also with us is DJ in the house.
Oh, yeah. Oh, hey.
In addition, Cameron has, he's left me some notes. One of them tells me that we can expect a guest to join us later, an OBGYN. Wow. Okay, so we'll be able to look forward to that. It's really nice to have...
I'm back?
Yeah, you're back.
Sorry, the teeth guy took my phone.
The teeth guy?
Yeah, the guy was looking at my teeth. He's not a dentist.
Okay. All right, well, are you sure that you're in like a safe area? Because that doesn't sound safe.
I'm telling you, Dr. London, I'm barely alive with what we're going through out here. All right, do you want me to just spill it?
Yeah, before I'm pretty curious what's going on here.
Dr. London, I'm at Area 52. It's right down the street from Area 51. We had stopped over here just for some churros.
Are churros popular at Area 52?
There was a churro guy here. I don't know. I can't answer any more details on that, Dr. London. Oh, God, Dr. London, it's been an adventure.
Okay, because you left, I want to say, it was not long ago that you left for this adventure. But, you mean the last hour? It's been an adventure?
Oh, Dr. London, it's been such an adventure. Barely alive over here.
Okay. All right, we're going to go ahead and move on, but I guess feel free to guide us along to help us stay with... What was that?
Well, I thought it was an alien, but it was just the churro guy again.
Okay. Well, so we're going to go ahead and move on, and just, as usual, we do appreciate your help with, helping us to stay with what people want to hear. So, feel free to keep chiming in as you usually do.
Here is the truth, Dr. London. That's what I'm down here for. Or I'm not, I'm at Area, I'm not at Area 51 yet.
Okay, but you're at the neighbor.
Here's the truth, Dr. London. The kind of stuff that you're trying to hide.
Okay. So, well, I'm going to go ahead and move on to some listener feedback, if that's all right. Okay. So, the listener feedback is, quote, "Can speak to manager who is not having a seizure. Please and thank you. Google manager who is not having seizure to complain about seizure on my order. Didn't order seizure." End quote. First of all, thank you so much for your response. We always appreciate it when our fans reach out with us to us with questions, and we are happy to try to address them whenever possible. So, if I may restate the question, it sounds, listener, as if your waiter was having a seizure, and since you did not order a seizure, you wish to ask the manager to bring you a waiter who will bring you your food order rather than a seizure.
Well, they at least shouldn't charge him for the seizure.
Well, I mean, I'm not sure that was the issue. It sounded like, but yeah, I'm sure that the manager would sort that out. That probably seizures isn't what they would pay for, especially if they didn't order it.
That's not what they ordered. They shouldn't pay for it. I would. Hey, listener, I would say go back to that restaurant and say, I don't want a seizure anymore.
Oh, you think that they left and that the patient or that the listener had a seizure?
Yeah.
Okay.
If that's what they ordered, that's not what they should be getting. That's all I'm trying to say.
Okay. Well,
I know you're always thinking about businesses. I'm thinking about the people, which is why I'm out here risking my life while you're up in just a cozy studio apartment.
Okay. I'm sorry, when you say risking your life, aside from...
I'm barely alive, Dr. London. I'm barely alive.
Wait, when you say barely alive, what do you mean by that?
It's just the risk that you have to take to come out here, Dr. London, to stand up to the government. It's that kind of risk. I'm barely alive.
Like, do you mean like you just drove to that area and that to you is barely alive?
Not yet. Area 52. I'm not at Area 51, but...
Okay.
But the risk involved, Dr. London.
Right. Okay. Well, I guess, so to finish answering that one question, I would say to the listener that you should probably focus a little bit more on making sure that the waiter is okay, because if it's, what I suspect is that the waiter had a seizure and that he did not intend to bring a seizure rather than the food order. He just, he has, I assume that this waiter had a medical condition that caused that seizure to happen. And that should be addressed as soon as possible. But after that, then the manager or maybe another waiter would be happy to address the listener's concerns with the food order. After that,
and you should be honest about it. If you did order a seizure, but then that's not what you really wanted, don't say, I ordered something different and you gave me something different. Be honest. But sometimes I'll do that. I'll order the wrong burger and I want to say, oh, you did it wrong. But that's not right. They get blamed for that, That comes out of their paycheck. So if that's what you ordered was a seizure and that's what they gave you, just be honest about it. That's all I'm trying to say.
Okay, that's given
here at
that...
Area 52, that's what we care about is honesty. That's why we're here. We're almost there.
Okay. That's, given your understanding of it, that sounds right. Well, to that listener, thank you for reaching out, and I hope that both your issues and that of the waiter are resolved in good time. Now for a tale from surgery. What is it, Cameron?
The churro guy again. Go ahead.
Okay, so now for a tale from surgery.
He keeps popping up behind me when I don't know that he's there. That's all I'm just trying to say.
Well,
I think under these circumstances, it's very rude for someone to do that, but, here we are.
The circumstances being that you drove up to this churro stand?
Yeah. And
you don't think it's appropriate for him to be there?
I think there's something up with why he's here. Who does he work for? That's what I'm trying to get to the bottom of.
Okay. All right, well, I'm going to go ahead and I'm going to share a little, an anecdote from our surgery. So we had a patient in pre-op waiting to go into surgery. Then we found out that the patient's blood sugar is extremely elevated. So we asked him, and yes, he knows that he is diabetic. So we ask, why don't you take your diabetes medication? And he says, I control the diabetes with my diet. At this point, it is worth noting that he was unable to fix his eyes on any of us who were present because his uncontrolled diabetes had literally made him blind. Anyway, they managed to get his blood sugar down enough to go into surgery, and he was soon ready to go back to his life of being free to avoid taking medication, if that was his desire, which it seemed like it was.
Dr. London?
Yes.
Dr. London?
Yes.
Dr. London, you hear me, Dr. London? There's a development over here.
Okay. Tell me what you're seeing.
The guy, the churro guy, he's closing down. He said he's done selling for the day. It's only 8:30 p.m. Does that not sound weird to you?
That sounds reasonable considering you're in the middle of a desert, right?
Can't stay open till 9 in the middle of the desert.
And you already bought your churros, right?
Well, yeah.
So why do you? I guess why do you care?
No, it's suspicious, Dr. London.
Okay. Well, right.
There's something about this guy, Dr. London.
Okay. Well, okay. And I should say here, you've done this before. Please do not follow him home.
Yeah. Oh, okay. We will not. I'm talking to the tooth guy right now. We're not going to follow the churro guy home. Okay. Wink, wink.
Okay. Used a lot of double negatives there, and you said out loud, "Wink, wink."
No, I didn't.
Okay. Okay. Well, you didn't actually now.
You did.
Okay. Please don't follow him home. Because remember, you have your Area 51 mission. You don't want to miss that, right?
Oh yeah, that's right. Well, I'm gonna try to do both. All right, go ahead.
All right. Now for today's topic, atrial fibrillation. Now, we all know that when people are alive, they tend to have a heartbeat. But what actually makes that heartbeat happen? What makes that beat? Well, you have parts of your heart called nodes that send out electrical impulses to make each and every heartbeat happen.
I'll tell you what makes it happen, Dr. London.
I was about to... Okay, you go ahead, I guess.
Yes, staring truth in the face when you're not supposed to. Look in the eyes of one of these alien creatures at Area 51. That's what gets my heart beating.
Okay, well, so that's one. So, but the physiological method is the sinoatrial and atrioventricular nodes, more commonly known as the SA and AV nodes.
I've got tons of notes. I wrote down notes about the churro guy. I wrote down notes about the tooth guy.
Okay, well, these are NODES as opposed to the written notes NOTES. SA and AV nodes help to set the normal rhythm of the heart. But however, in atrial fibrillation, this rhythm is lost and the heartbeat becomes irregular. So clinically, atrial fibrillation presents with an irregular pulse, so that both the rate and the rhythm of the beat are irregular.
You're saying, Dr. London, that if you're looking for a heartbeat and it happens to be irregular in a person, then maybe they're not human at all. I see what you're saying.
No, okay. No, I'm saying if it's irregular...
non-human, irregular heartbeat. Okay, this is good. Because I have a feeling this guy with the churros...
You're still following him?
There's something about him, man.
Oh, it sounds like he's... The weirdest thing about him is that he's selling churros at Area 52, wherever that is. Anyway, I'll just finish explaining this real quick. Let's see. In other words, the heart is beating abnormally, and therefore the blood in the heart has a chance to slow down and actually clot. So that clot can be sent to the brain or elsewhere in the body.
But give me a churro. Because it's only 8:30. I can still have a churro. Just give me a churro and then I'll take your pulse. Sorry, Dr. Lennon. Go ahead. This guy's impossible.
Okay. All right. Well, please don't hurt him.
I'm not going to hurt any humans on this trip. I promise that.
Well, anyway, so in atrial fibrillation, if you've ever seen movies or shows where they do that whole, they're in the hospital and they yell, "clear," and give them a shock. that's if the patient is unstable with atrial fibrillation, they do that for this type of person. They give them the shock. And that shock is like slapping the nodes of the heart so that they can come back to their senses and then set normal rhythm again. All right. Did you get your churro, Cameron?
Yeah, and his pulse. Well, okay, his pulse is. I think it's 630 over 1420.
Okay, so pulses are just one number. So
I think it's 630 over 1420 is what I'm getting.
You know where you can feel your pulse on your wrist. You count the number of beats in 15 seconds, then you multiply that by 4 to get beats per minute, or the pulse.
Yeah, so 630 over 1420 is what we're looking at, which I think is irregular, Dr. London. So I have a feeling. Shut up. I have a feeling this guy might be irregular, like you were saying, non-human.
Okay. Well, all right. Well, do we have any sponsors today?
Do you want me to shout out your churro stand on my podcast? Okay. Well, he doesn't want me to shout out his churro stand, but I'm just going to do it anyway. If you go to Area 52, there's this guy here with an irregular heartbeat.
And that's how you'll know it's him? Yeah.
Check his pulse. If he's around 630 over 1420, then it's the right guy. You have a coupon? He doesn't have a coupon, but just ask for 10% off and just say that I sent you.
Okay. All right. Well, I guess for any listeners who live at or near Area 52, they can visit this churro stand. And I'm sorry, when you say he's a sponsor, you didn't just he's paying for a sponsorship, right?
Are you gonna pay for the sponsorship? He said no, but I'll try to get it out of him.
Okay.
I still have his hands in a hold because I'm still taking his pulse.
Okay. Well, anyway, I guess we can move on from there, especially for his sake. So we have a guest. You said you actually got us an OBGYN. Is that right?
That is true.
And it was odd the way, because you left me notes for everything, and the note you left was follow the trail, and they will be there. And so anyway, it was a whole thing, but we did find them. All right, and here's our guest.
Hello.
Hello, and is it Dr. Kathy? Is that right?
Yes.
All right, well, it's nice to meet you.
It's so good to be here.
All right, well, I'm drlondonsmith.com, and we have our producer Cameron on the line as well.
Hi, Cameron.
Hey, can you hear me? Hi, hello?
Yeah, hi. Thank you so much for asking me on.
Yeah.
All right, well, yeah, so I think Dr. Kathy was saying that she had sort of an unusual case for us.
Oh, yes. I, as an OBGYN with, 20 years of experience, I come across a lot of really interesting cases. The body is just a mystery. So anyway, I was really hoping that I could share one, if you don't mind.
Sure, okay. That'd be interesting.
Okay, so...
The guy really wants to hear.
Sorry, what was that?
Just the churro guy really wants to hear this.
Oh, do you have it on speakerphone so he can hear? Okay, well, yeah, he's welcome to subscribe and all that.
Right, he's not going to subscribe.
Okay, that's fine too.
We'll give you $35 to subscribe.
No, okay, stop offering him, because I know you're just giving him my...
So is it okay if I,
all right, we're good.
Ahead?
Yeah, okay, go ahead with the case study,
okay.
Sorry.
Okay, great. So I recently had a Caucasian patient who presented to my clinic with complaints of an upset stomach and vomiting, and the vomiting persisted for 8 days. And they had also developed a fever of 101 degrees Fahrenheit that seemed to have come and left before they got to the clinic. But the patient also mentioned a recent history of trekking through the remote jungles of Georgia and, quote, chugging that sweet stream nectar, which I thought was very interesting. So
that is unusual. Okay.
Sorry, what was that?
I'm sorry. Yeah, no, that's interesting. But you have more, or is
yes?
Okay.
On physical exam,
Sorry to interrupt. The churro guy wants to know if he can sell some of this nectar or if you have like a copyright on it.
I think that would be great when directed to the patient.
Okay.
The doctor, from what I understand, was not there.
I don't have any of the sweet nectar.
The churro guy just looked really disappointed in that answer, but okay.
Well, okay.
Yeah, sorry to hear that.
Okay, whatever. So on physical exam, there was no murmur, gallop, or rub. There was no chest wall tenderness, although they did have some notable tenderness around the tatas without discharge.
I'm sorry.
Sorry, what?
Did you say tatas?
Is that a...
You're talking about... Well, I'm sorry. It's just not a medical term I'm familiar with.
Oh, I'm sorry.
The chest
when you've
wall...
been in the business for 20 years, maybe you'll learn.
This might
You're
be...
obviously new.
I'm really sorry for Dr. London's behavior. He's not comfortable with women. He's not comfortable with men. He's not comfortable with just normal people talking real stuff. You know?
I am using the correct terminology.
Okay. Since you're referring to the chest wall tenderness and that area, were you referring to the nipples for this discharge?
Yes, the nappies.
Okay, so as long as we know what you're referring to, so those
yes.
There was no discharge.
Yes, so
but there's tenderness.
So they did have some notable tenderness around the milky milks without discharge.
Okay.
Is that clear for you?
Now
do you
is,
understand?
Yeah, I'm sorry for interrupting. Go on.
Thank you. So there wasn't anything else that was extremely interesting, although their abdomen was possibly distended. No fluid wave, but the fullness appreciated suprapubically.
Okay.
Anyway, whenever we got to ultrasound, the technician was unable to find a uterus, which was fascinating.
Okay.
Furthermore, the patient is adamant that though the patient has never seen a sex, they have heard of the associated dangers of STDs and would most assuredly shoot a sex on site should the opportunity arise.
Okay, I guess I'm confused about a few things, but I guess that last part. So the patient had never seen the way you phrase it makes it sound like sex is a separate creature.
They'd never seen a sex, correct.
All right, and so do you have a diagnosis you're thinking for this?
Yes. So in my opinion, given these findings, the patient was likely pregnant. Most likely pregnant.
Okay. So you couldn't find a uterus.
Well, no, but
and
given my experience, I know what I'm looking at, and it is a pregnancy.
So you mentioned, I guess, the vomiting.
Miracle.
I'm sorry, could you repeat that part?
The miracle of life. I was just kind of basking in the glory of the miracle of life, whereas you seem to be offended by it. That's all.
Okay, well, so here's one issue I have.
Of a pregnancy trips you up. But me, personally, I think it's beautiful. But that's just me.
So whoever this...
the guy and the teeth guy agree with me. Life is beautiful.
Okay, and I'm not disputing the beauty of life or the miracle of life, but what I am disputing is, so given what you've said so far, that they had been vomiting for
yes,
what was it, 10 days or so, had a fever off and on, and they had been drinking out of a stream. It sounds like it could have been, some viral or bacterial.
Given my findings, all of these things point to pregnancy. Yes.
The tooth guy wants to bring up that if you're throwing up a lot, it's gonna ruin your teeth. That's what he says. The acid in your stomach ruins your teeth. He just wants to talk about teeth. I think he just wants to contribute. Sorry, go ahead.
Okay, well that is true. For those, this is sort of a separate note, but for those with a history of bulimia or where you vomit frequently, that acidity can wear down your teeth, wear away your teeth. So that's a fair contribution, and that's one reason why you would definitely want to avoid those practices, but also, of course, general well-being.
He wants to see your teeth. Send a picture of your teeth.
I don't think I would like to.
He's getting so mad that you just said that.
I just don't think that there's a reason to send him.
He's a picture of his teeth. Okay, just go ahead.
Okay. All right. So that's what I'm wondering here is what made you decide, like, as opposed to having like a stomach bug or something, what made you decide that this patient? And sorry, you never even mentioned the gender of the patient.
I'm sorry, I don't really see how that's relevant.
Yeah, well, okay.
And also, it really didn't come up. I mean, these things don't always come up. And besides, I would never presume to ask someone such a personal question. After 20 years of experience.
And that's where I do have to disagree a little bit, because if you're OBGYN and you're assuming that it's a pregnancy, usually like that generally happens in women, in females, not in males, because they have
what?
A uterus.
I'm not really familiar with the term, but I think what you're talking about might be a paginus. That's the more professional term.
Okay, well, that's a term with which I am unfamiliar.
Or maybe a nene.
Okay, sorry, you said you had the patient here?
Yes, go ahead.
Oh, howdy.
Hi, I'm sorry, what was your name?
Sorry, Dr. London. I'm getting a question here. How are your teeth?
You're talking my teeth?
Yeah, patient. How are your teeth?
Oh, my teeth are terrible. Let me tell you, that sweet river nectar just does a doozy on your teeth.
Okay, that's what Tooth Guy was concerned about, whether or not the nectar was going to screw up your teeth. All right, go ahead.
And I guess, sorry, on that note, the way you're talking about it, was that sweet river nectar?
Oh, you want to know about the river nectar?
Are you referring to moonshine?
No, the sweet river nectar. See, here what you do. Hop in your pickup.
Okay.
Go drive to Kentucky. Pick yourself up a bottle of Kentucky's finest bourbon.
Wait,
Okay?
drive all the way to Kentucky.
Listen, are you going to listen?
I'm
Or are you just
sorry.
going to keep talking?
Go on. I'm
So
sorry.
you pick up a bottle of Kentucky's finest bourbon. You get yourself a watermelon. Are you following me?
Yes.
Okay. What did I say you need to get?
You said get a bottle of bourbon,
Yeah.
Kentucky's finest, and then you get a watermelon.
Exactly. So what you're going to do, you're going to take that watermelon. You're going to drill a hole in the top of that watermelon, okay?
Okay.
You're going to dump that bourbon straight down. Just let it tilt it upside down. Let it soak in that watermelon. You're going to stick it in the nearest creek, nearest river, whatever you got. Cool that thing during the summer, and then you got yourself some river nectar, son.
Okay. So the river nectar, it's named after where you keep the watermelon in order to refrigerate it.
More or less, yeah.
Okay. So really, you're talking about a sort of watermelon drink based heavily in bourbon.
Sweet river nectar.
Sweet river nectar.
I'm sorry. So you're familiar with the term?
I mean,
Dr.
she's my
Kathy?
doctor. She has to know all this stuff.
Sorry,
Stop.
Cameron, are you back with us?
Yeah, sorry, the churro guy's tickling my feet.
That guy got some churros over there? Tell him to save me some. Bring some back.
I'm sorry. He's
Yeah, I can
tickling
bring
your.
some back. Oh, stop.
Oh, I love some churros.
I would also like a churro.
Okay, so you have a rapport with him now. You trust him now?
Yeah, I'm still taking his pulse, so he can't really go a lot of places, but stop.
Okay, well, so my question to this patient of ours here, I'm sorry,
Shoot.
this patient of yours,
Yes.
what made you...
You should ask me the question,
Well,
and then
I
will,
defer to my doctor typically,
So,
Dr.
I will
London. I'm sure you
rephrase it.
understand.
What-
as you don't seem to know a lot of the correct terms.
Just keep in mind, you don't have to say anything that incriminates yourself.
Thank you. Thank
Just
you.
because Dr. London's questioning you, just defer to your doctor. They'll handle it.
That's some great advice.
whenever you were deciding on a doctor, what made you choose Dr. Kathy, an OBGYN in particular?
He saw the sign and
That's right.
walked in.
That's right.
It's as simple as that.
And the sign
Amen.
said,
OBGYN.
and
That's
you
right.
and you thought, I'm sorry, because you look and sound like a male.
I don't
human.
understand what that has to do with anything, but yeah, sure.
Well, OBGYN, so
I'm
Oh.
sorry. Are you asking him questions directly now?
I was more just about to explain the terminology in general. So OBGYN refers to...
Listen,
I gotta interrupt here, Dr. London.
Okay.
Just because he might deliver mail does not make him any less of a person.
thank you.
I know that in this day and age, with the internet and email and all these things, it's easy to say, "Oh, you're a male guy. You know, you're worthless. You don't count anymore." But I'm here to say I think that's ridiculous.
And I don't discriminate. I just want that to be clear. In my practice, we see everyone. Doesn't matter if you have a tootie or a winky, we'll see you.
Okay.
Wow.
Doesn't matter if you have a TT or a duty, or a cookie or an uh-oh, or even a tallywhacker, we'll see you.
Dr. London refuses people with the duty or atchie?
The reason being, so an OBGYN is a fairly specific specialty of medicine where it stands for obstetrics and gynecology. So the OB is, like, obstetrics refers to, like, pregnancy and childbirth.
I'm sorry, I don't think you... I don't know where you went to school, but...
Yeah, I'm going to
have
defer to
never
Dr.
heard of
Kathy on
that.
this one. That sounds like a load of bupkis.
OBGYN stands for "Oh baby, grab your nappies."
That's right. That's right.
I'm here to tell you. So, wherever you went to school, they're clearly making up words.
It's that coastal elite, just eliteness that comes from the coast.
And I'll tell you, I'm tired of the dang elite, man.
Mm-hmm. Agreed.
Okay. And
Oh baby, grab your nappies.
oh baby, grab your nappies.
Yes.
Is
Grab them.
your understanding of what OBGYN stands for? Because they're just shortened versions.
It's what it stands. It's not my understanding. It's what it stands for.
So those are just, like, they aren't. You're using it as an acronym, whereas they're just shortened versions of words. They're obstetrics and gynecology.
I know what an acronym is. Thank you.
Okay.
Oh
So-
baby, grab your nappies.
And then gynecology would be just the female reproductive system and female anatomy.
Yes, nappies.
And so,
Dr. Lund, can we just get to the point? I am with child, and I have to take care of myself.
That's right.
so in the patient note, as was presented by Dr. Kathy here, it sounded as if you have a stomach bug because you drank something, or possibly you just have some sort of stomach virus. And
Are you trying to blame this
The patient
on my river nectar?
has a child. We don't refer to babies as stomach bugs.
and I'm trying
How
to
dare you?
That's
honestly.
very insensitive.
figure out
Honestly,
exactly why you think he is pregnant, because
My tatas are tender. Have you had tender tatas before, Dr. London? It is painful.
well, I
There's no other explanation.
thought, like, perhaps the nausea, because morning sickness is often a part of pregnancy,
yes.
a reported symptom. But
I throw up at least once a week. Let's be honest.
is that new?
No, of course not. I've been with child for a while.
For how long?
Oh, for a while.
Are we talking days, months, years?
I would say it's been about 11 months.
That sounds about right.
Okay. Well, that's
I've been seeing this patient for quite a while. We've been tracking the pregnancy, and it seems to be progressing well. So
when was, and this would be just a part of it, how you would calculate. When was your last menstrual period, sir?
Menstrual period. Dr. Kathy, you track this stuff.
this patient has never seen a sex. So,
I ain't never seen sex.
and honestly, why would you bring up men again? I don't understand why you have to bring men back into your phrasing.
Okay. Well,
Hey!
sorry, Cameron, what's going on there?
Oh, sorry. The churro guy was just trying to leave. I grabbed him. He's good. Go ahead.
All right. Well, and I guess I should ask Cameron a few questions here. Cameron, are you any closer to Area 51? And why are you going to Area 51?
Oh, you're at Area 51?
Well, no, I'm at Area 52, and the stuff
Oh.
came up with the churro guy, and then the teeth
Yeah.
guy started getting antsy. And so we've just been listening to the podcast.
Okay, so we have some new listeners.
Well, I mean, they both of them have refused to subscribe even after I gave them the $35, so I don't think so.
Okay, and you've got to stop giving people my money. I assume this is my
That's
money.
a pretty good deal.
Yeah, I feel like it's a pretty good deal.
Yeah.
It's definitely a steep discount.
A discount?
Yeah.
Do you normally charge people to listen?
I don't take less than $50 to subscribe to a podcast.
Because the podcast is free. This is an educational, free, sort of public health, public service, community podcast. And you're charging people for it?
Yeah.
All right, well,
He really wants a picture of the patient's teeth. He's saying the nastier the better. I don't know.
I'll send him a picture of my teeth.
Okay, yeah, he'd really appreciate that. Oh, God, he's rubbing his hands together.
okay, I guess I have a few further questions to ask here because, okay, if considering that is what your understanding of OBGYN means, what is your clinic like? It sounds maybe like you're more of a maybe homeopath medicine, like natural.
I'm an OBGYN.
Oh, baby.
Oh, baby.
Grab
your nappies.
Your nappies. Okay.
Oh, baby!
Let's say a new patient walks in, and they see the sign outside, OBGYN, and they go in, and let's say that they think they might be pregnant. Let's say it's a female patient.
I'll be the judge of that.
Okay. Female patient.
Also not relevant.
Okay. So they come in, and they go to your office, and what do you... how does the process go? You
insert my hands into the vaginas, depending on what they have. If they have a dangler, very different sort of.
Okay, well, let's go into
examination.
That. How would you examine if the patient, like our patient here, I presume, possesses a dangler, as you call it?
I don't want to talk about my patient's dangler.
I don't know
if
I'm 100% comfortable.
I don't want to talk about his
doctor sharing this
specifically
information.
his dangler. I mean,
why are you talking about my dangler?
I have a question. Is a dangler the same as a droopy loopy?
One of the
Similar,
same.
yes.
One
yes.
of the same, I'd say.
Yeah.
Also the same as a PP or a Linus or a Winker. Are you familiar with those terms?
No. But is it far off from a droopy loopy?
No, it's not.
Okay, so
I've got one of those. That's fine, right?
Is it extra droopy loopy?
To say extra is to imply that it was once not like this.
So is it more loopy or more droopy?
It's getting loopier by the day.
Okay. And how are your Lulus?
It's just falling off.
Falling off. That is interesting.
Like evaporating, I should say.
Any orange discharge or
Tons. Oh my gosh, tons.
I've
yes,
been there, brother.
I think I would definitely recommend you come in and we have an examination because there's definitely something going on.
Okay, and it's not going to mess up my teeth, right? Because the tooth guy's he's kind of making a lot of sense now.
Not your facial teeth, no.
all right. Well, Cameron, do we have a sponsor today?
We do, Dr. London.
Oh, good.
Smoking is really, really difficult to quit. Okay. A lot of people are moving towards vapes, but there's a lot of questions with vapes. Are they safe? Are they healthy?
Yeah.
There was a scare about popcorn lungs some years ago.
Mm-hmm.
So I want to talk about Zippler vapes. It is organic, healthy vaping system. I've switched to it. It's been great. What's that, Dr. London?
Well, okay, because it's still a vaping system, though.
Yeah.
Because that puts it in the same category as the other ones, from what it sounds like.
Healthy, organic vaping.
I don't... In what way is its organic take different from that of the other vape?
The others are unhealthy, unorganic vape systems. This is a healthy, organic vape system. And only one of its kind.
What makes it so... What makes it organic? What do you mean by that?
Well, it's not unorganic like the other vape systems.
Okay, so the way that it is organic is just that it is not
unorganic like those other ones. Do you want me to show you?
Maybe. Okay.
We can do a demo right here on the podcast.
Okay.
All right, let me get this situated and started. All right. Let's see here. All right, you're going to want to get it started.
Oh, okay, wait. This doesn't sound good.
Yeah, no. In fact, if it's not making this sound, you want to throw it into a fireproof bag immediately. This sound means it's working properly.
This is a vape?
Yeah. Look at those clouds. Oh, man. Oh, the flavor. Ooh, that flavor.
It smells so much of gas.
Wow. That flavor, so smooth and completely plant-based.
Okay.
Wait. Let me...
This sounds...
A Zippler vape.
And you refer... And that's all organic?
Yep. All plant-based. Not unorganic like the competitors. Zippler vapes. Buy them today.
I don't know.
Oh crap. I need a fireproof bag. Give me a fireproof bag. Give me something.
Oh, you
Throw
think
it
that I
in.
have
Give
that?
me blankets. I need blankets. Let me wrap it in. Okay, let me wrap it in. Okay. Okay, we're good. I think we're good. Just... Okay. All right. I think we're safe.
Okay.
Zippler vapes.
That doesn't sound good.
The number one healthy and organic vaping option.
Okay, so if we could get back to... That kind of leads us into this question of what the first exam will look like if a patient has a Linus rather than...
So why are you so interested in...
I'm trying to...
visualizing what my patients' Linuses look like. I do fear for their safety when people ask questions like this.
Right, it's more...
It's a little disconcerting. What do you say?
It's more to find out what your examination process is rather than what their particular body part looks like.
I don't think they would really be happy with me discussing what the process is.
I apologize to interrupt, Dr. London. I think something's happening over here. Something big.
Okay, what's going on there?
Something that's not human at all, Dr. London. Hey!
Oh, when you say not human...
You're an alien, sir. Excuse me, sir. Let me... Hello, Dr. London, can you still hear me?
Yeah, I can hear you.
I think I something. Come here, mother... God. Okay.
Okay, what are you seeing?
It looks exactly like the churro guy, but I know it's not him. Let me check his pulse to make sure.
Okay, that is not...
Let me check.
If you see a sex, make sure to shoot it.
His pulse is 540 over 1390. This is not the same guy.
I don't understand how you're getting that reading. Please don't hurt anyone.
I'm just checking his pulse. Come here, mother... Just checking his pulse, Dr. London. I'll get back to you.
Okay, thank you for checking in here. I guess what I'm wondering, Dr. Kathy, is just... Okay, here's a basic question. How many patients do you have currently?
I have many patients.
Okay.
I also have the gift of patience.
Okay. And so whenever you say
come
many...
in handy being on your show,
okay.
Dr. London.
Do you have any patients beyond the one present here in this room?
It sounds like, Dr. London, you have no patience. That's what it sounds like. Maybe you should learn to have some patience with your guests.
Yeah, it's like my grandpappy once said, you never look a gift horse in the broadside of a barn. Am I right? Am I right, Dr. Kathy?
Exactly.
Okay.
Started fidgeting again.
Okay. Wait, sorry. Who started fidgeting again?
It's the alien. Who might be, well, I know he's not because of the pulse.
That he's not an alien?
He's not the churro guy from before. He just looks exactly like him, and he seems to have his keys.
Okay, because you know a pulse isn't like a fingerprint or something where you can identify people by that. Like a lot of...
It's an irregular, inhuman alien reading, Dr. London. Irregular alien heartbeat.
Are you familiar with aliens, Dr. London?
I don't believe that most people are not familiar with them because they... If they exist, then they have not made contact.
Obviously
with
one
most...
does. He's just chased it down.
And I'm sorry, we kind of skipped past it a little bit. You said... So typical pregnancy takes about 11 months. Sorry, about 9 months.
That's about how long it's taken so far, Dr.
About 9 months.
11 months.
Every pregnancy is different. Every patient is different.
Well, that's true.
So I like to approach it knowing that you never know when the baby will show. You never know what's going to happen next.
All I know is it'll be beautiful.
Yes.
So typically...
So in this case, yes, we have 11 months, going on 12. Wait, the baby will be here any day.
Okay, because a typical pregnancy is going to last around 9 months. Some babies are born premature, but...
Maybe your typical pregnancy, but all bodies are unique. We're all human. We're all unique.
That's right.
We all have fingerprints and different eye colors, different hair colors. Some of us have...
They're cheering.
Well, I'm not done. Some of us have JJs. Some of us have winkers. Some of us have TTs. Some of us have duties. We're all special. And the same comes with babies and how they're born.
Mm-hmm.
Every pregnancy is special.
Dr. Kathy just knows exactly how beautiful life is. That's why I'm glad she's my OBGYN.
That's why I have so many patients.
Okay, well, on that note, that was, I don't know how medically accurate, but great speech. I think we'll start to sort of maybe wind down here. Cameron, how are things looking for you over at, have you made it to Area 51 yet?
Oh, no, I mean, we're still just chilling.
Okay, are you planning to get there for, I've heard on social media there's some special storming Area 51 day. Is this about that?
Huh? What? What?
They said that they're storming Area 51, like it's some social media thing.
Go back on social?
Okay, social media, like we're talking about Facebook or Instagram, Twitter, because you were supposed to be in charge of those for our podcast.
Is that like a TV show?
No, although you can post videos on those. But no, they are their own things.
The churro guy's gonna help me set up a Twitter.
So we're pretty far into our podcast, and you haven't set up a Twitter account? Because that was like a day one thing.
Well, it's not day one.
Yeah, okay. So anyway, so all that to say, you didn't know about the whole storming Area 51 this weekend. That's a whole thing.
No, just kind of hanging out.
So you deciding to go there out of the blue was just to do it.
Well, yeah, it was my desire to kind of take down this kind of mirage that the government has set up to kind of blind us, to make us, see things that aren't really there, or not see the things that are really there, trying to, take the red pill here, get out of the matrix. You know what I'm talking about?
Yeah, I get it. The timing just seemed surprising considering.
The churro guy's tickling my feet again.
Did you find that the churro guy is the same one that you thought was an alien again?
TBD. He tickles the same, at least. I know that much.
Okay. Well, thank you, Cameron. I think we're going to go ahead and finish up today. We very much appreciate. I appreciate that you tried to get us a medical professional on this one. I was fooled at first.
Sorry, tried?
Dr. Kathy's very
well, thank
good.
you for bringing on the OBGYN. Thank you, Dr. Kathy, for coming on the show.
You're welcome.
On the podcast.
I'm really glad to have been able to share my expertise with you.
All right, and thank you, Cameron, as always.
And I do. I want to challenge the listeners to take a picture of your teeth this week, and then you want to send it over to, what's your name? Yeah, Tooth Joe, near Area 52.
Wait, his name is Tooth Joe, like as in one tooth?
Yeah. So just take a picture of your teeth, send it over to him. Oh God, he's salivating over it again. All right, keep going, Dr. London.
Okay, well, yeah. So I was just saying, thank you, Cameron. I guess thank you to Tooth Joe and the churro guy as well. Cameron, please don't hurt him. Please do not hurt him. Please don't.
Fine. Look at his pulse. I took his keys.
Okay. Thank you to DJ Dylan in the house. And we'll see you guys next time. Wait. Okay, please stop. Hold on, full stop. You are obviously about to delete this podcast from your phone and then drinking away all memory of it. But please think about your family first. Now you might be thinking, what family? You mean those filthy rats who betrayed me? In reply, I would have to say no. Those filthy rats you found in your basement are not your family. And frankly, their betrayal kind of seems insignificant compared to the fact that you trusted them with your emergency funds. Just because you find rats living in your place doesn't mean that they are your family or that you should trust them.
But sometimes close friends are family, It's right here.
Yeah, but
it's family, bro.
So rats are they're vermin, though.
Yeah.
Okay, family, most people don't say like I wasn't affirming what you just said. It's in contrast. Like I'm saying,
Hey, sometimes blood isn't thicker than water. You know what I mean? Sometimes a friend is a family.
Okay, so in terms of a rat infestation, though, right? Okay,
Here.
So in summary, the rat infestation in your home is not your family, and you should also continue listening to the Jock Doc podcast. In addition, you should follow us on social media at Jock Doc podcast, and even more importantly, message your loved ones our handy website jockdocpodcast.com. And that can send them to whichever podcast platform they prefer with just a couple clicks. Thanks for listening.